How long do dental implants last in 2026? Dental implants have become one of the most trusted and successful solutions for replacing missing teeth. In 2026, millions of patients worldwide are choosing implants because they offer benefits that dentures and bridges often cannot provide. They provide stability, long-term function, bone preservation, natural appearance, and improved confidence. But one question continues to dominate patient concerns before treatment begins. How long do dental implants actually last? The answer is both encouraging and more complicated than many people expect. Modern dental implants are designed to be long-term restorations, and many can last decades with proper care. Some patients still have functioning implants after 20 to 30 years or more. However, implants are not indestructible, and their lifespan depends heavily on several important factors. Important factors include oral hygiene, bone health, implant quality, surgical precision, smoking habits, bite forces, and long-term maintenance. The biggest misconception in modern implant dentistry is believing implants are permanent and require no maintenance. In reality, implants are highly durable, but they still require long-term professional care and patient responsibility. One important detail many patients do not realize is that dental implants consist of multiple parts. The implant is the titanium or zirconia fixture placed inside the jawbone. Attached to this implant is an abutment and a visible restoration, such as a crown bridge or full arch prosthesis. These components may have different lifespans. The implant fixture inside the bone often lasts the longest and may remain stable for decades when healthy bone integration is maintained. However, the visible prosthetic restoration may eventually require repair adjustment or replacement. This can result from wear chipping bite stress or material aging. So, how long implants last depends partly on which part of the system is being discussed. Research shows modern implant systems have very high long-term success rates, often exceeding 90 to 95% over 10+ years. Many well-maintained implants continue functioning successfully after 20-25 and even 30+ years. Some patients may never need replacement of the implant fixture itself during their lifetime. However, restorations attached to implants may require maintenance sooner, depending on material quality, bite pressure, and oral habits. Porcelain crowns, for example, may experience wear fracture or aesthetic aging, especially in patients with strong bite forces or grinding habits. Although implants are highly successful, not all implants last forever. Failures can occur due to biological, mechanical, or lifestyle-related reasons. One of the biggest causes of implant complications is peri-implant disease. Peri-implantitis is an inflammatory condition affecting the tissue and bone surrounding implants and is similar to gum disease. If untreated, peri-implantitis can lead to bone loss, implant loosening, and implant failure. Poor oral hygiene remains one of the biggest risk factors. Smoking is another major factor associated with reduced implant success because it affects healing and bone integration. Patients with uncontrolled diabetes may also face increased complication risks because healing and immune response may be compromised. Teeth grinding places excessive mechanical stress on implants and restorations and can cause prosthetic fractures, screw loosening, and implant overload. Implant success is influenced not only by surgery but by long-term lifestyle and maintenance habits. Not all implant systems are identical, and quality matters. Premium implant brands invest heavily in clinical research, surface technology, long-term studies, and digital integration. Cheaper implant systems may reduce initial costs, but long-term predictability and support can vary significantly. Many modern implantologists increasingly prioritize long-term ecosystem reliability over short-term pricing alone. One of the biggest changes in modern implant dentistry is the role of digital technology. Today, advanced implant clinics increasingly use CBCT imaging and AI-assisted planning,